Human Metapneumovirus HPMFE. HPMFE, or Human Metapneumovirus, is a respiratory virus that primarily affects the lungs and airways. It was first discovered in 2001 and is closely related to other respiratory viruses such as respiratory syncytial virus (OSV). HPMFE can cause illness in people of all ages, but it is particularly concerning for young children, elderly adults, and individuals with weakened immune systems.
Coughing, fever, runny or stuffy nose, sore throat, wheezing, shortness of breath, fatigue, loss of appetite, headache, muscle aches. In more severe cases, HMPV can lead to pneumonia or bronchiolitis, inflammation of the small airways in the lungs, especially in vulnerable populations like infants, the elderly, and immunocompromised individuals. How HMPV spreads. HMPV spreads through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted by touching surfaces contaminated with the virus and then touching the mouth, nose, or eyes. As prevention tips, there is no specific vaccine for HMPV, so preventing its spread relies on general respiratory hygiene and infection control practices. Here are some key prevention tips. Hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing. If soap and water are unavailable, use hand sanitizer with at least 60% alcohol. Cover your cough or sneeze. Always cover your mouth and nose with a tissue or the inside of your elbow to prevent the spread of droplets. Avoid close contact. Stay away from people who are sick, and if you are ill, avoid close contact with others, especially high-risk individuals like the elderly, young children, or those with weakened immune systems. Disinfect surfaces. Regularly clean and disinfect commonly touched surfaces such as doorknobs, light switches, and phones. Wear a mask. In crowded or indoor settings, wearing a mask can help reduce the spread of respiratory viruses, including HMPV. Stay home when sick. If you are feeling unwell, stay home to rest and prevent spreading the virus to others. Treatment for HMPV. Currently, there is no specific antiviral treatment for HMPV. Treatment is generally supportive and focuses on relieving symptoms. This may include rest, hydration, fever-reducing medications like acetaminophen or ibuprofen, cough medicine or throat lozenges, depending on symptoms, oxygen therapy in severe cases, especially for those with breathing difficulties. Complications of HMPV. Although most cases of HMPV are mild, the virus can lead to severe respiratory conditions like pneumonia or bronchiolitis, particularly in vulnerable individuals. Hospitalization may be necessary for those with severe symptoms, and the condition can occasionally be fatal. When to seek medical attention. If you or a loved one experiences any of the following symptoms, it is important to seek medical attention immediately: difficulty breathing or shortness of breath, persistent high fever, severe wheezing or coughing, fatigue or confusion, chest pain.